Diagnosis was probably the hardest part of the entire process. It's probably the worst thing that can happen in life is having something wrong with your child. So for us, definitely diagnosis day was pretty much the worst day of our lives. Yeah.
From the moment the doctor said they did find something, I remember sort of kind of turning into this like robotic, movement where, okay, and I started just writing down whatever the doctor was saying.
It was really hard in the beginning. I didn't know where to go. I didn't know any neurosurgeons.
As with any type of rare illness, you are so scared, you're so petrified. Craniopharyngioma being such a rare tumor, you just start looking and looking, trying to find the best possible treatment.
The first question anyone should ask their surgeon is, how often have you done this? And what is your approach, and what is going to be the goal of this surgery?
And I encourage other parents, never be embarrassed, always speak up. I remember when Charlotte was first diagnosed, it was hard for me to even make a phone call and ask a doctor, how many times have you done this surgery on someone that's 3 months old? I look back and I'm like, thank God I did that. So always speak up, always ask questions. And yeah, Dr. Storm was always available to answer anything that we needed.
We are privileged to be able to provide care to these children, and I mean that means a lot to everybody, and it's a privilege, and you have to earn it.
I think that level of sort of calmness that the whole hospital has with new or novel or unusual disease is helpful for the families because they can just see it as a health problem that we know how to treat.
It being a stroke, it just took me totally off guard. Within a few hours, we were at CHOP, and Dr. Eichord came in. She first gave us the diagnosis was, this is Moyamoya disease. Yes, it's very rare, but let me tell you about it. And she knew everything about it.
When we sat down with Dr. Storm, that we felt like he was competent, he was confident, and I think even Lucas said it himself that he just made him feel comfortable. And I think that's where we felt like, here's the surgeon that we really want to trust our child's life with.
I felt very comfortable right away. Not only is he an expert and very skillful, he had amazing bedside manner. Not only did I look at him as a neurosurgeon, I looked at him as a human and a dad.
We see our own daughters in those kids' faces. From that respect, it's harder, but I still wouldn't do it any other way. It's just the way you're made, is to care about kids.
When we do these surgeries, it's great to have a team that does a lot of them, and that's why we've chosen a kind of a very collegial, multidisciplinary approach to treat all these patients from the first time that they've been diagnosed with a tumor and then their long-term follow-up.
People that are dedicated to pediatric neurosurgery, in particular, bring a level of competence that can't be replaced.
Anesthesia is a huge part of anything, and it's actually the scariest part for me. Another thing that brought us great comfort is that they are pediatric anesthesiologists, and they do this every single day with small children.
Having a board-certified pediatric anesthesiologist who is also specifically trained in neuroanesthesia and neurocritical care as a part of each patient's delivery of care is incredibly important.
I definitely would recommend if other parents research all the different specialties within the hospital. Number one being the neurosurgery, but all the other specialties that will affect their child.
I think one of the big benefits of having your neurosurgical care at CHOP is that all the other related fields are so strong. Neurosurgery is rarely a condition where you have one surgery and you're done. I mean, there are those, we have plenty of those, but in general, these are complicated patients who need a lot of care. All that happens under one umbrella.
The quality of life post-surgery is just as important, if not more important in a way. It's been really, really nice having all of his care taken care of at CHOP. With one visit, we're sort of like all together. We're all on the same page.
I felt so comfortable, from the nurses to my social worker, who I still talk to every single day. CHOP and Charlotte's pediatrician, are always in communication, and my pediatrician is always getting reports from CHOP. It does become your family.
everyone's at the same institution and we're all looking at the same data. And we're all, in fact, most of us are meeting once a week at conferences discussing their care. And I think it's refreshing to the families to know that everyone's thinking about their care.
I was diagnosed with a brain tumor at 13 years old. My surgery was on February 14th, 2007. I had a 13-and-a-half-hour date with Dr. Storm. The care was phenomenal. It's one of the reasons I want to be a nurse. It goes beyond patient and care provider. It goes more to a personal level.
So what I love most about being a pediatric neurosurgery nurse practitioner, honestly, is to see the patients and the families say to me, my daughter or my son is doing well, and they're going to college now and they're able to drive.
My wish for Charlotte is to have a beautiful life, and she's already inspired so many people. So I want her to continue to do that and just to love and be peaceful and grow into a beautiful young woman.
I can be in the kitchen making cookies and she can play. She's okay. I try to live every day and let her be a kid.
Lucas is now 3 years out of surgery. He goes to school. He has fun with his friends. He goes on play dates. He plays sports. He fights with his siblings. He says no to me for every other thing that I ask him to do. He's just a typical 11-year-old boy. That's what makes me grateful. That's what makes me happy. And also that's what gives me hope.
Have faith, have hope, and put your faith, put your trust in people who you choose to care for your child.